Welcome to the North Carolina Medical Society Spotlight. I'm your host, Sue Ann Forrest. Today we're in Mount Olive, North Carolina at Mount Olive Family Medicine Center to hear from Dr. Kevin Talton and Ashley Long to learn a little bit more about their concussion project. Thank you both for joining us today.
Thank you.
Thank you.
So we're going to talk a little bit about your concussion project. Can you give me some background information on that?
We've been having a concussion clinic here for about a year, and it started with our awareness and realizing that students in the area didn't have access to concussion education, concussion baseline testing, or post-concussion care. And so we planned for about 2 years, and then last year we're funded to begin our clinic and go out into the community, talk to people about concussion, do some baseline testing with middle school and high school athletes, and then see patients in the clinic if they did have a concussion.
So where did your funding come from? Because you had to...
We're funded by a grant through the North Carolina Department of Health and Human Services Office of Rural Health. So our first year we received their innovation grant, and we also received some funding from the Carolina Panthers charities. And then this year, in order to continue, we received another grant from the Office of Rural Health, community grant, which has the potential to be renewed for 3 years. So we were excited to hear that they wanted to continue to support this clinic and our project.
Yeah. So why is it important to screen for concussions?
Well, concussions, as you may be aware of, and has really come to the forefront as far as affecting the overall well-being of a student athlete. Not only can it affect their physical performance, but also their cognitive performance and how they're doing in the school, in the classroom. So it is important that we screen for concussion and identify it appropriately, as well as manage it appropriately, so that not only we return the student athlete back to the field to be able to play the sport, but also return them back to the classroom where they can continue to learn and prosper.
So how many patients have you served so far through your program, and do you think the program has raised an awareness in this community about the effects concussions can have?
We just recently, in the beginning of fall sports season this year, crossed a threshold of doing 2,000 baseline tests. So that's students in Wayne and Duplin County, middle school and high school students. And last year, for the academic year, we served 34 concussion patients in the clinic, half of which were female, and from a variety of sports.
Do you think other family medicine providers are aware of this issue as they should be? Are you seeing an increase in awareness on this, or appetite to delve into this issue a little bit more?
I think other providers are aware of concussions, and particularly the dilemma that they face in trying to appropriately manage someone after they've had a concussion. We're fortunate here at Mount Olive Family Medicine Center to have Ashley Long doing baseline testing and then post-injury testing for us to help us understand or know when cognitively they're ready to go, begin the return to play protocol. Yes, I do think there's an awareness. I think there's a lack of resources that are available to those providers for them to feel comfortable returning student athletes back to the field.
Now, you've done some work down at the General Assembly too to try to educate legislators on this issue. Could you tell me a little bit about that?
We have. I think our objective is to let them know who we are, build a relationship, tell them about the disparity that exists between our urban and rural areas when it comes to student-athlete health care and concussion care, and try to build support and consensus around the importance of this priority. And now I think we're at the point where we're looking for solutions that can be applied and best practices for how we address this problem.
We've had legislators come to the office, meet with us, really genuinely want to learn what we're doing here. And there's thoughts, ideas, taking this regionally. Again, the resources are always limited, particularly in Eastern North Carolina. But with the impact that we're having now and the results, we're hoping to be able to offer some solutions to a great need here.
So what I'm hearing both of you say is that, and what I hope that our members take away from this video, the importance of baseline testing, and I hope that maybe some other family medicine providers will take an interest in spreading baseline testing into their own communities, into these rural areas that may not have access to it otherwise. So Dr. Talton and Ashley, thank you so much for joining us for this video.
Thank you.
It was a pleasure to chat with both of you and learn a little bit more about this issue.
Thank you.
Thank you very much.